medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Better believe it, boy. Of course, we have 6 minutes after the hour of 10 o'clock. This is what we say good morning to you wherever you are inside this beautiful Monday between the hours of 10 and 11. You know, Casualty 911 is on. So this morning here with me is fun, but we have to say good morning to our friend, Miss Wilson. Good morning to her. Good morning to all the avid listeners, always locking it down religiously. Okay? Welcome inside another Casualty 911. Let me say good morning to you, Miss Fawn. Welcome.
Morning, Erlan. It's a pleasure to be back. I think I was here 2 weeks ago. I'm losing track, age.
Okay.
I'll blame it on age.
Okay.
So, Louisa and I have not been doing our usual alternating, so I think I'm a little bit confused. But I'm so happy to be here. Welcome to all our regular listeners, our new listeners. Thank you for choosing 88.5 Casualty 911 this morning. To all the parents who sent their little ones and older ones off to school this morning, I hope you had a good transition from home to school.
Most parents are go, what a sigh of relief.
I think some of the children were anxious to get back and some not so much.
Yes.
And that is always the case. But hopefully, within the space of this week, everybody will readjust and they will make a success of the new term. So just to remind the parents as you send them off, try to keep it positive and also to help them out by packing as nutritious a lunch bag as you can. Reduce the sugar. So things like boxed drinks and the prepackaged juices or juice drinks, please reduce or remove. Water is excellent. It is very hot these days. Pack extra water. There are some children who don't drink the water from the tap, from the mains. You drink bottled water, so you need to pack some extra water for them. I remember back in the day when we were at school, we used to drink from fountain and tap and everything, but that is not so common these days. Give them extra water, give them some fruits, reduce a bit on the salt and the sugar. So thank you again for being with us. Today we have a very special guest joining us, and she's going to be delving into a topic that we have not really spoken about on the radio program since we started. So today we are going to be talking about sickle cell disease, sickle cell awareness this month. We're going to talk about sickle cell. And with us this morning, I hope she has joined in, is Dr. Ferdinand-Walcott. Before she gets into everything relating to sickle cell, I would really love for Dr. Walcott to tell us a little bit about herself, a little bit about her work as a medical practitioner. Dr. Walcott, welcome. It's a pleasure to have you.
Thank you, Fawn. Are you hearing me clearly?
Yes, we can.
Okay, wonderful. Thank you so much for having invited me on your show today. It is an honor to be here this morning. My name is Deanne Ferdinand-Walcott. Fawn and I went to convent together many moons ago. But I spent some years working at Victoria Hospital Pediatrics Ward. So people probably don't know me unless they've had kids that have rotated through there. And the past 5 or 6 years, I've been at the station at the Grizzly Polyclinic. So I'm a district medical officer. I'm also the vice president of the St. Lucia Medical and Dental Association. So I have a few roles, but I'm really happy to be here this morning, especially as September is recognized as International Sickle Cell Awareness Month. So thank you so much for having me here.
Thank you and welcome again, Dr. Ferdinand-Walcott. I think I forgot the first part, and I actually only knew you as Ian Ferdinand and not the Walcott. So today we're going to be delving into what exactly is sickle cell disease. We'll talk about sickle cell disease versus the trait, some of the symptoms, the causes, how to live well with sickle cell, things that we can avoid in order to better manage the condition, and who is most at risk for sickle cell disease. So, Dr. Walcott, you can go ahead and start off wherever
Okay.
you feel comfortable.
All right. So I'm sure in St. Lucia, many of us have heard of sickle cell disease. First and foremost, it is not a contagious disease. It is an inherited disease. So we get it from parents. Parents pass it on to their children. Worldwide, it affects 20 million people in the world, and it's mostly of Afro descent. So the non-Caucasian population is the population that is most affected, and that is what we have in St. Lucia. So we see quite a number of patients with sickle cell trait, sickle cell disease. It is a disease of the blood. The blood contains two main parts. The liquid part, which is the plasma, and the more solid part, which consists of, some of them consist of red blood cells. The red blood cells have a protein on them that carry the oxygen from the body. That protein is called hemoglobin. So hemoglobin has a particular structure that is the gene is what predetermines or sets the structure of the hemoglobin. If there is any issue in the structure of the hemoglobin, when it's not normal, that is when you can see different types of sickle cell disease appearing. A normal hemoglobin would have two genes, A and A, one from the mother, one from the father. So when the two A's are together, you have a normal hemoglobin, and the person be classified as normal. However, if the patient has one S from the mother, one S from the father, S hemoglobin from the father, and they have hemoglobin SS, then the person has full blown sickle cell disease. It can also occur that you get a good hemoglobin from one parent and a sickle hemoglobin from another parent combining to make an AS hemoglobin. In that case, you would be considered a carrier, or you would have the trait of sickle cell. You will not be considered to have the disease, as most people with sickle cell trait go on to live perfectly normal lives, just having to abstain from certain things and being careful to remain hydrated. In St. Lucia, sickle cell cord blood screening, how is it diagnosed? It's diagnosed with a blood test because it is a blood disorder. So in St. Lucia, since 1992, we've started screening all newborns through the cord blood. That's the cord from the baby to the placenta, which is attached to the mother. So at birth, a little of that blood is extracted from the cord and it's sent to the lab. And we ask all parents to return in 6 weeks to get their sickle cell blood test results for the baby. Now, a lot of people forget because having a newborn is nothing easy, but we encourage all parents to know the sickle cell status. So with the cord blood, it will give us an idea as to if the child is exposed, if the child has the trait, if the child will go on to have the sickle cell disease. So basically, that is what sickle cell disease is, and that is how it is diagnosed. Anybody of any age, if you don't know it, if you did not find out as a baby, you can go in and have a blood test called an HB electrophoresis at any age and determine whether you have sickle cell or any of the sickle cell diseases, the SS, beta thalassemia. You can have hemoglobins that are C, D, and any combinations of these can give you the signs and symptoms of the sickle cell disease. The normal ones are the E. So I don't know if that covers.
Wonderful. So, Doc, anybody born before 1992 may not really be aware of their status. So, if you're not aware of your status, is it really that important? I'm going to put it that way. Is it really that important to know your status as it relates to sickle cell?
That is right. Most people before 1992, like us, may not have known our status. Okay. So it's very easy. As I said, it's a simple blood test, and it is actually part of the antenatal screen. Why is it important? Because the mother, if you have family planning and if you have childbearing age, then it's important to know, because if you at least have even the trait, then your partner, we need to know both of your status. So your status and the status of your partner. How does that affect the child? If you are AS, your partner is AS as well, which means you are both carriers. You would have no symptoms. There is no way of telling without doing the blood test that you carry the sickle cell trait. So it's important to do, because if both parents are AS, there is a 1 in 4 chance that the child inherit the S from the mother, the S from the father, and have the full-blown sickle cell disease. There is also a 50% chance that the child gets an A from one parent, an S from another parent, and carry the trait. There is a 1 in 4 chance as well that the child gets 2 perfectly healthy genes, AA, and have no issues. But that 1 in 4 chance is very, very important, and it's for every single pregnancy. So if you have you both have the trait and you have a child born with the full-blown disease, that child got the 1 in 4 chance, unfortunately. At the next pregnancy, that other child also carries a 1 in 4 chance. So if each pregnancy you have a 1 in 4 chance, a 25% chance of the child being born with full-blown sickle cell disease, and that carries a number of complications. So it is very important that both parents know their status. It is routinely done for the woman, and we encourage, if there is a trait or the disease, that her partner be screened as well. It's part of the antenatal screen, but we encourage persons of childbearing age, even before they get pregnant, to do the screen so they know the risks involved.
Wonderful, because many I would imagine that many women only find out whether they have the trait when they actually do the antenatal screening. So is that test readily available, and would you have an idea of what it costs?
Okay, so the hemoglobin, the HB electrophoresis, is done in the public lab, which means usually once there is reagent, it is done. It's usually done in batches though, so there may be a wait, maybe 1 or 2 weeks. If it is done as an antenatal screen, the antenatal screens are covered with the government, so it would be a free test. It would be one of the free tests that the pregnant mother would have. But if a layperson were to go in, I don't think it's more than $30 at the public lab. That's at the lab at the hospital, the grocery polyclinic, etc. So I don't think it would break an arm or a leg to get it done, even if especially if you're not pregnant. And if you are, then it's free.
Okay, wonderful. Now, Doc, I mean, it's great that you're advocating, and I think everybody should take it into consideration. However, one of the things we know is that generally we don't like to go to the labs to do tests unless we think it's absolutely necessary. And how will I put that? When we do that screening, usually by that time, both parties would already be in a relationship. They would already be in a relationship with each other, and it would be very difficult to convince, I suppose, to people who are already in a relationship that they cannot go ahead and procreate because of. But as you said, Let us try to do it before we get into the relationship, before we start thinking of being with somebody long term. So we already know the status, and I guess that is one of the things we would add to our list of questions as the relationship becomes more serious.
Definitely. I believe one of the first things, if you're interested in somebody these days, is to have a lab date, because all of the diseases running around, you need to get screened for everything, and that should be one of the screens.
Okay. All right. So, Doc, can we talk a little bit more about sickle cell disease? What are some of the symptoms? What should people look out for? And what are some of the complications that can occur if one is living with sickle cell disease?
Okay. All right. So, what happens with the actual disease? I said what it was. I said it's a disease of the blood. I said how you acquire it through the parents. But what does it look like? So, a child born with sickle cell disease should have no symptoms until the age of 5 or 6 months. Why is that? Because we're all born with hemoglobin F, which we have in our mother's womb. It's called a fetal hemoglobin. That acts as a protective shield, I would put it as, against the complications of the sickle cell disease. After that, the fetal hemoglobin, because our normal hemoglobin, our normal red blood cells last about 3 months in all of us, in healthy persons. They have a life of lifespan of about 3 months. So after that, you find that you have less and less fetal hemoglobin, which is a protective hemoglobin. At around 5 to 6 months, the sickle cells start. And why do they call them sickles? Sickles have the shape of like a half moon. The normal red blood cell is kind of disc shaped. So when you have a nice round disc shape with no edges, it passes smoothly through the blood vessels, large and small, and also it is not as sticky as the sickle cell. So when you have sickle cells, they tend to clog up they're one, more sticky, and two, they tend to clog up in the smaller blood vessels. That is why they produce the symptoms that they do. When they clog up the blood vessels, they cause damage to the organs that they're preventing the blood flow into. So in babies, you will see more swelling of the hands, painful swelling of the hands and the feet. That is called dactylitis. It's quite painful. The child may be fussy, the child may have fever, the hands swell, the feet swell, and it's really, really hard to see. But it is one of the first signs and symptoms that you would get in a child, in a baby, as they progress into the full blown sickle cell disease. As the children get older, they get less and less of the dactylitis, the hand. What they get is a decrease in blood flow to the longer bones. So you're talking about the bones of the arm, the bones of the legs. They can get it in the ribs, and they get abdominal crisis. So pains in the belly. Sickle cell can cause what you call asplenic. Basically, the spleen is an organ behind the stomach on your left side under the rib, and it causes the clots in the spleen so many times over and over that the function of the spleen is reduced. What does a spleen normally do in the body? It provides immunity. So it prevents us, it helps us fight different diseases. Okay, so when that function of the spleen is decreased due to the disease, then the kids are at risk of many infections over and over and over. That's why you see with sickle cell, people with sickle cell disease, they're always in the hospital, they're always calling out sick, they're not as strong or robust as their counterparts. Okay, so that is
So, what
another
type
way.
of infections, Doc, would be most prevalent?
Okay, so we have infections due to bacteria, encapsulated bacteria. So we have Staphylococcus. I can name the different bacteria, but it's basically bacterial infections. And so for these group of persons, the vaccinations need to be very up to date. We cannot allow anything to go to fall through the cracks, and they need an extra pneumococcal vaccine, which is another type of bacteria, to fight against the disease that usually attacks them because of the lack of immunity. So basically, they're immunodeficient, but because the skin is not working properly. So yes, anything that passes, they can pick it up basically, but it's usually the encapsulated bacteria, which we may be able to fight more easily, but they have no defense against it. One of the things that's done is they're given antibiotics prophylactically, which means even before you get the disease, you take penicillin, sometimes every day, to prevent any infection from happening. And that happens up to the age of 5 years old, usually. We do that for all our sicklers because we know that the decrease in the immunity, the ability to fight infection, puts them at greater risk of getting all types of infections, even infections of the brain. So we want to prevent that with both the vaccines, the pneumococcal vaccine specifically, along with your usual vaccines, and using an antibiotic every day, a penicillin every day, once they are not allergic, to prevent these infections. Go ahead.
So I was about to ask you, so the penicillin would be administered at home?
Yes, it's a liquid
Okay.
because they're babies, they probably won't be able to swallow tablets, so we just dose it as a syrup and then they ingest it. The parents will give it to them.
Okay.
Other things that you can look for, signs and symptoms, would be jaundice. Jaundice is the yellowing of the skin. And if the child is dark skinned, you may not see it, but you can definitely see the whites of the eye turning yellow. Okay? Why does that happen? Because the blood cells, the red blood cells, have a shorter life in the case of people with sickle cell disease. One of the things that happens is not only that it clogs in the small blood vessels, but it also breaks apart very easily. And when they break apart, they release this yellow substance, okay, called bilirubin. So that increases. You can see the increase on a blood test of the liver enzymes, and you can just see it clinically. You can look inside the mouth, it has a yellow tinge. You can look in the whites of the eyes. You can probably see it in the palms of the hands as well. So that is called jaundice. So obviously, when the blood cells break down, your hemoglobin count goes down. That produces what we call anemia. When you have a low blood count, that is called anemia. What does that look like? It looks like the children are always tired, even adults as well, always tired, irritable. They may feel lightheaded. For babies, they may not say they're tired, but they seem fussy. They look pale. The lips are pale. The hands are pale. When you do a blood count, for most people with sickle cell anemia, we consider 7 to be acceptable, a hemoglobin of 7 to be acceptable. However, for a normal person with HbAA or a person without sickle cell anemia, a normal hemoglobin would be about 12. So you could see the huge difference between the hemoglobin levels. So there is a chronic anemia. When I say chronic, it's just there all the time, and it's because of the disease process, which puts these persons now at risk of having to have blood transfusions over and over and over again, which brings its own set of risks, right? With every blood transfusion, we the lab tries to make sure that everything is tested and everything. However, there's always the risk of you having a blood transfusion reaction. There's always the risk of having an infection. There is also a risk of depositing too much iron in your body, into your liver, from repeated blood transfusion. So you see that in older persons who've had several blood transfusions throughout their life. Now, note that the blood transfusions are necessary because having a low HB, you feel breathless all the time. You cannot breathe because there is nothing to carry the oxygen in your blood. You need the hemoglobin, you need the right red blood cells. But all of these things have their side effects as well. So basically, that's the main things you would see in children and adults as they go through. Obviously, the most dramatic ones would be the painful crisis when they come in, they cannot breathe, they're coughing, they have high fever. You do an X-ray and see sometimes the whole lung is white because of some infection, or the blood flow is not it's not flowing properly, and so they have a chest syndrome, they have abdominal syndrome. Sometimes for the boys, you can see that the sickled cells have blocked the blood flow out of the penis. And so they have a sustained erection for about 4 hours. That is called priapism and it's very painful. And so some of these persons have to come into the hospital to be drained in the ER. And there's several complications. For the older persons, there is a loss of blood to the head of that long bone you have in your leg, the hip bone. We call it the hip bone, but it's the head of the femur. And when that is gone, basically it's a replacement that you need. It just dissolves. It seems to, on an X-ray, it looks like it's actually dissolving in the joint, the head of that long bone. So you have several complications. It's not an easy road. It is. It requires a lot of forethought, planning, especially if you're going out, because cold can be one of the risk factors to cause a crisis. Being dehydrated, these days is very hot, is another way to provoke a crisis. So it is there are a number of things that the sicklers have to deal with. And yeah, it's when you see these signs and symptoms, it's better to seek medical attention and have a plan with your medical caregiver, especially with fevers in young children and pain in the older persons.
Doc, we often talk about fevers in the babies and young children. What is the level of the fever where you would advise or recommend that a parent with a sickler take their child immediately to seek medical attention?
Okay, so with a sickler, I would say 100.4 Fahrenheit. That's about 39 degrees Celsius, or 38.7. So it's and once you know your child, I always say the person to know their child best is the parent. So you can tell me if something is off with the child. The child feels warm to you, you check the temperature, okay, it's about 100.5. Not a high fever, however, you see the hands are swollen, the child is fussy, not eating well, a little pale in the mouth. Do not stay, do not wait. You need to bring that child in so the child can be assessed and treatment can be started as early as possible. Because remember, they are at increased risk of infection. They cannot fight the infection as well as somebody without the sickle cell disease.
Okay, so in other words, we don't depend solely on what we see on the thermometer. We have to be very observant and look out for other symptoms as well.
Correct.
Okay. And Doc, since it appears that sickle cell is a very serious disease, how would you advise people living with sickle cell disease? What would you advise them to do in order to probably reduce the number of crises? What would you ask them to avoid in order to meet that same objective, to live as uncomplicated a life as possible, because as you explained it, it can be very painful, and I guess most people would not like to go to a hospital frequently. So is there anything that can be done to reduce the number of crises or the severity of the crisis?
Yes, I think that is very important because once you have the disease, your focus should not be on, oh, woe is me. Your focus should be on how can I deal with this and how can I make it better for myself or my family. Speaking while as a person grows up, obviously maintaining hydration, which means taking in lots of water, making sure that wherever you go, you have a supply of something to hydrate you, whether it be coconut water, water. I know a lot of people don't like the taste of water, but I mean, you can put a little lemon, a little something in it. That's not an excuse, because it's really hot these days and we need to maintain our hydration. As I said before, maintaining warmth. It's maybe we not may not have this problem these days, but for the persons working in AC, especially, the cold can really affect them and cause them to go into a crisis. Traveling long hours on a boat or a plane, you need to make sure that they get up, that they are warm during the flight, that they are comfortable, that they move around a bit, they don't sit the entire flight. Starting with analgesia, which is a painkiller, they can start with simple paracetamol and work with their healthcare provider to see how they can be best managed. Because the more pain you have, the more difficult it is, especially when you have the chest syndrome, the more difficult it is to take deep breaths. And taking deep breaths is part of the therapy to get better. So you need to be out of pain enough so you can take the deep breaths and so the healing can occur in the lungs. As I said, the prophylactic antibiotics is very important, especially for the kids who are less than 5 years old, and making sure that the parents go through the usual St. Lucia vaccine schedule, as well as getting the pneumococcal and sometimes meningococcal vaccines, which provide protection against bacteria that can infect the brain as well. There is also a drug, it's called hydroxyurea. This medication is available to the sicklers. And what does it do? It helps prevent the cells from sickling. So that is a really good drug, and it works for most people. For some people, they may not, unfortunately, be able to tolerate it. So there are blood tests that you need to do while you're on it, and then you maintain your dose. The dose is varied. It starts off slow and you build up until you get very few crises a year. But it's a drug that we have seen promise with, and it has helped a lot of the sicklers, preventing them from getting repeated blood transfusions.
Okay.
Of course,
And okay. Go ahead.
I was just saying, and blood transfusions, if they need it, it can be life saving as well. That's another one of the treatments that we have. So these are the things we want to do. We want to make sure that we're well hydrated, that we eat properly, that we don't stay out too late, partying and drinking, and getting dehydrated and too tired. And we need to take care of ourselves once you are diagnosed with the sickle cell full-blown disease. For the trait, hydration and warmth
Hold
seems
on
to,
a little while. Let's go back a little bit to the drug.
yes.
Are there any serious side effects of that drug that sicklers should know about if they were
De-
to consider it as an
yes,
option?
definitely. So your healthcare provider would have to discuss that with you. The hydroxyurea can suppress the bone marrow, and it's a bone marrow where we produce all our blood cells, the red blood cells, the white blood cells. So that is why you need to constantly be doing blood tests to make sure that is not happening. Though it is rare, it can happen. So once you see anything looking disturbing, you stop the medication right away. You check the liver enzymes, you check your blood count and everything. and then unfortunately it would not be the right choice for you. But that's the most serious complication.
Okay, and my other question is with regard to um, our lifestyle. You spoke about not going out and partying. Two things. Is a sickler able to engage in normal physical activity? And are they able to drink alcohol, or should they avoid it completely? And what about smoking? Whether nicotine or marijuana, because we know marijuana is very common.
Mm.
The use of it is very common in St. Lucia. So can you just
Okay.
speak a little about?
Okay. So let me start with the last one. I would treat a sickler when it comes to these things as I would. My advice would be to a sickler as my advice to would be to anyone else, that it has been proven that smoking takes away from your beauty, from your life, and from your health. Okay, you can see that smokers, their skin is much more aged and everything. Their health, their teeth are discolored. The breath is not the best. So that's just, superficial things. Start with there. That can that alone can influence somebody. Health wise, it takes away days, weeks, months, depending on how long you smoke from your life. And already you have chest, you can be at risk of having chest infections. So that puts an extra burden on your oxygen carrying capacity. So I would advise against it. And that goes for both cigarette and marijuana smoke. With regards to alcohol, I think the best thing would be to stay away from it totally. But if you must take something, if it's your birthday or something, I think it should be safe for very little and very special occasions. You can have a sip or something. Um,
Are
with
there any
reg-
specific risks of alcohol as it relates to sickle cell disease that you'd like to
well,
share?
the fact that sickle cell disease puts an extra strain on the liver, and the liver is what clears our body of toxins. Alcohol is a toxin, so I would not add to the work of the liver
Okay.
in that case. So I would advise against it. And when you have the liver not being processed, not processing things properly, is when you get the jaundice, the yellow color, and all of that in the body. Um, yeah. So
Exercise.
can they participate in normal physical activity? I think they should participate in some physical activity. Due to the anemia, they may be more tired, they may be not as athletic, depending on which bone has been damaged, which bone is painful. So I think everything in moderation as much as they can. Some people tend to not be as affected as others, especially if they have a high level, they maintain a high level of the fetal hemoglobin, and so they don't have the same clinical picture as others. So others may be sick, others may not be able to participate in sports because it makes them dehydrated fast, and they don't have the capacity within the lungs, in the body, to participate in it. But each is an individual thing, so you'd have to discuss it with your healthcare provider and see how much physical exercise is okay for you as an individual.
Okay. And particularly for children, I would imagine that parents who have sick children, children with sickle cell disease, may be very protective and may not want to allow their children to participate in certain forms of physical activity or exercise. So I I guess in that event, as you said, it's best to have a conversation. But I do know that some people can be very, very overprotective.
Mhm.
But
So I
there
would
are
not.
benefits to doing physical activity, participating in physical activity for the children, even though they are sicklers.
Exactly. And the same as for asthmatics. You will not say that an asthmatic cannot play. You would just have the child in a corner. There is a
Exactly.
limit, right? Even if asthmatics, we encourage physical activity. So with sicklers, it depends on the severity of the disease. If the child, whenever the child runs, the child gets an attack, maybe it may be that the child is not hydrated properly. So there are a few things we can try. We can check the hemoglobin, can make sure that the child is not anemic, and see how best the child can be managed to live as full a life as possible.
Wonderful.
In terms of a cure, is there any known cure for sickle cell disease? You spoke about the promise of that drug. I cannot even pronounce the name. I can't remember the name, unfortunately, but
Mhm.
it seems to be very promising. Is there anything else that we could speak about in terms of a cure for sickle cell disease or a
Oh,
treatment that
well,
would make life as normal as possible?
yes. I think if any of the medical professionals could snap their fingers, it would probably be to do a stem cell or marrow transplant. And that is as close to the cure as there is presently that is being researched. So that is removing all the cells and putting in a new set of stem cells. That's the cells that produce all your different cells. So you would put in cells that are healthy, and so they continue to produce healthy cells after that. That is not in St. Lucia. I don't think it's in the Caribbean. It's in very specialist clinics, sorry. And so it is something to aspire to. It is something that where research is being done, but that is where we have as close to a cure as we can get for now.
But not necessarily accessible to us in
No,
St. Lucia.
no,
But it's something to look forward to.
correct.
Now, we have spoken a lot about sickle cell disease. Is it possible for somebody carrying just the trait to have any symptoms or for it to affect their life in any way? Their life, their health in any way?
Mm-hmm. Okay. So the short answer is usually no. Usually, persons with sickle cell trait do not ever know that they have a trait. It may be that if they go for long periods dehydrated, excuse me, they may feel some aches and pains, not take it for anything. They probably, if they have a long plane flight, they may have some aches and pains and not take it for anything. Could be stiffness, they would say. But having the painful crises, the anemia, the turning yellow, the jaundice, the destruction of the bones in the body, the priapism, none of that affects the strokes, which affect the people with sickle cell disease. None of that usually affects people with sickle cell trait. So usually they go throughout their lives, they may living absolutely normal lives. So that is why it's important to test the partner as well if you know that you have a trait. So then the risk of having a child with sickle cell disease, you would know going in what it is.
In terms of work life, does it, are sicklers able to usually have a normal work life? Or is that something that is very individual in terms of the number of crises and the severity of the crises that they have? Is it possible for them to just have a normal-ish life in terms of going to work daily? And is there
Yes,
any type of work that they should avoid? For example, shift work at night and that sort of thing.
yes. Okay, so normalish would, sorry, I think I was muted there. Normalish would depend a lot upon the individual. So there are sicklers who are able to balance, to manage their lifestyles, to remain hydrated, to keep warm while at work, and have a very, very, very near normal work life. that people who don't know them probably wouldn't even know that they have sickle cell anemia. However, for a lot of others, um, having work, as you said, maybe as a security guard, and not being able to rest adequately when they go home, you see these persons coming in a lot. You see, so maybe shift work may not be the best type of work. Persons who have to work lots in the sun without hydrating properly, that may pose an issue as well. But for most, I think it is possible to have a normalish work life. But compared to somebody without sickle cell disease, yes, they tend to miss more work days because of the disease. It may not require them going to the hospital per se or being admitted to the hospital, but they may need days where they take just to recover from a painful crisis, to take to rest, to hydrate, and to take the painkillers that they need to take.
Okay, thank you. Is there, as we come to, we're basically very close to the end of our program, Dr. Ferdinand-Walcott, is there anything you would like to add before we end the program? Any words of encouragement to the sicklers? Anything that we may have missed out on during our discussion?
Okay. So I think as solutions, we need to be very much aware that sickle cell disease is prominent amongst us, that we need to be aware to screen, especially those young people growing up, know your status, not just HIV, but sickle cell as well. I want to encourage all the sicklers that you're not alone, that there is a group. The St. Lucia Sickle Cell Association has been around for the last 36 years. There is an office on Bridge Street. Their number is 453-1011, and they also have a Facebook page. So you don't have to be alone. They offer support, they offer counseling, they offer means and ways to liaise with government organizations so you can get assistance in whatever you need. And of course, the district medical officers, the doctors, the nurses, the health aides, we're all here to support you. As we know, it's not your fault. You know, it's a difficult thing. We just want you to live the best life that you can and continue to enjoy your life as much as you can. I thank you for having me.
Thank you, Dr. Walcott. We really appreciate your contribution to the program this morning, and we look forward to having you on with us to, talk about some other topic. I hope your experience was good enough that you would look forward to and really consider joining us again on the program at another point in time.
Thank you so much. I will. Thank you.
All right. And thank you to our listeners for tuning in. It was a very informative program. Dr. Ferdinand-Walcott shared quite a bit of information with us about sickle cell disease. And I would just like to repeat the number that she shared, 453-1011, for the Sickle Cell Association. As she said to you, it is a group where you can get some support. So sometimes we feel that we are alone, when we feel burdened, we feel overwhelmed. And she has expressed to you that the whole public health system is aware of what sickle cell disease is all about and some of the challenges and the difficulties, and they are there to support and to assist as much as possible. So thank you again for tuning in. On Monday next week, we will be joining you with a program on suicide and suicide prevention. Louisa will be joined by one of our mental health nurses. So I hope that you will tune in next week. It's a very important topic, and it is something that